you know that C-section is major abdominal surgery. Understanding what is happening to your body is the first step to recovery. And that's why I love to talk about these are the things that you can do. So let's talk about the wound. What is normal? What should you watch for? How are you going to heal? So I commonly get this question about numbness, tingling, even itching. Itching is not too surprising, but numbness and tingling really gets people worried. So the nerves in your skin and your abdomen were cut during the surgery, okay? So, yep, that was done. The nerves, blood vessels, those tissues were cut. As the doctors were moving from your skin to get to the womb, they were doing a series of cutting. What is important for you to remember is that they will heal, but that process can take some time, from months to years, okay? So the area around and below your scar will feel numb for some time. Dare I say, in some women, it may be forever. Some women, not everybody, most of us will recover. I remember after I had my CS, I definitely had numbness and tingling. I think it was going on a couple of years, actually. Got to the point where, I've regained full sensation in that area now. And I think I stopped worrying about it, of course, when I remember that, okay, your body's healing and every one of us heals to a slightly different rate. Okay, but I just want you to have it in mind that this is not an unusual symptom. It's not suggesting anything specifically different. But the important thing is that you are aware that it could happen and why it happens. Okay, and that it could take some time. Okay, and the other thing as well to remember is that tingling or itching, even zinging, pinging sensations, all of these could be signs of your nerves growing back, the nerves regenerating. Okay, so please don't panic. It might feel strange, but it is not a bad thing. Of course, any sensation that feels quite severe or that is persistent, or you've also comes with other symptoms that make you feel unwell, of course, you should discuss those with your doctor. Now, the other thing I want to talk about and which relates to that image I shared, let me just put it up again so that just to refresh your memory, okay? Because there's a reason why I put up this picture. The other thing I want to talk about is massaging the scar. Okay, and this is after you've had clearance from your doctor, please, okay? After you get the all clear from your doctor, and this will, for most women, will be between 6 to 8 weeks, okay? A gentle scar massage can be quite useful because it could help to break down internal scar tissue. Those are also scars are what we also call adhesions. So if you hear or read adhesions, we're talking about scars. So those scars in some women could actually glue the skin to the muscle underneath. Not in everyone. Most of us, the recovery tends to be fairly smooth. But for some people, because of the way that the tissues heal and recover, there could just be that sticking of the scar tissue that keeps the skin stuck or fixed to the underlying muscle, which can cause problems, especially when you're thinking about future CS or even future pregnancy. So it's something just to be aware of. And that is why some people do advocate for scar massage. Now, I will need to add that there isn't much research that has been done to find how well does this massage actually prevent adhesions. But some people find it helpful. It helps to restore mobility of the tissues, reduces tightness and pulling sensations, can even improve blood flow and help better healing, prevents chronic pain. And some people, say it can help the function of your deep core muscles. And I found a really useful resource from one of the NHS Foundation trusts. I will put it as a link to this video just so that you can have a read. And it also describes what exactly scar massage means, because you might think, this is not a deep-seated, heavy body massage. No, this is like taking 2 fingers and just lightly rubbing in circles along the length of your scar. Remember, you have been given the all clear. Your wound has healed. There is no bleeding. There is no discharge. There is no open or gaping of the wound. No, that wound is a clean wound. There is no pain from that wound. Definitely. After 6-8 weeks. It's not something to rush into, please. But it's as simple as, rubbing with a bit of oil that you're not sensitive to across your skin. Just light movements and doing that twice or thrice a day. Or you could just use vertical movements to rub up and down across your lower abdomen. It's as gentle and as simple as that, okay? So some people, like I said, find it very useful. I have to preface that it is true that there isn't much research on its value, but it could be something that you do as part of your your body makeover after a bath or a shower. You're just having a bit of me time. You might even be massaging some of this bio oil or oils into your skin for stretch marks, for example. Sort of that skincare, literally a few seconds to just have a gentle rub around the scar. But please make sure you've gotten clearance from your practitioner before you practice this. Okay, the other thing I wanted to talk about as well, so not just infection, because at this point, you will be told what an infected scar looks like before you leave the hospital. Your midwife, your doctor will tell you about pain or redness, smelly, discharge, swelling, redness, pain. Yes, those are the common things that would say to you to watch out for, with a scar. That's how you know that it's infected. But what about other things that could suggest infection? Not so common, but they could happen. One of them is an infection in the womb. Okay, so this would be a discharge from the vagina. Okay, and this discharge will be smelly. At this stage, within that 6-week period, we're expecting that your initial blood loss or lochia from having the baby should be reducing day by day, reducing in quantity as your womb empties itself, clears itself of all those things. Okay. And so if you start getting either very heavy bleeding, sort of randomly starting after 2 weeks when it was getting lighter and it's not fresh, it's smelly, or a discharge from down below, and you feel unwell, you might also feel not very well, very tired, or even develop a high temperature, feel sick, dizzy. These are all reasons. Please get medical attention promptly. The same applies to an infection in the bladder. Okay, you could have a urine infection, pain when you're passing urine, burning when you're passing urine. And sometimes it may not be exactly the way as it is if you're not pregnant. There may be a slight difference because a lot has happened down below, down in that area. But if you're experiencing those symptoms, you might even find that your urine is smelly or it seems, different color to usual, please do speak to your provider about it, okay? So, key points, you've had major surgery, okay? Don't rush to start exercise. Yes, we want you to be up and active, and the sooner the better, but not before time, not before your body is ready for it, okay? Walking around, remember my 2-2-2 rule I talked about that somebody shared with me, is a useful framework for how to move around. It's useful in terms of how to consider your activity level. So the first couple of days, you're sort of chilled, you're just resting on the bed, you're hardly moving off the bed, just resting, bonding, eating with the baby, resting and recovering. By the next set of 2s, then you're up a little bit, you can get up and move around to the chair beside the bed and sit up and, do other things. And again, you're feeding the baby, you're holding the baby, you're still in that recovery state. Then the next 2 days is you're a little bit more fit. You can move from, one room to the other to do things, not just to pass urine. You can take a bit of a walk around the room or around the house, not too long. You're gradually getting your strength back, okay? Now, the other thing that's useful when you have a scar, many of us who've had CS, when you want to laugh or cough, you know how the scar pulls, get a little cushion, just hold that against your tummy or your scar when you want to cough or laugh, or even if you're moving out of bed, because those tissues are still quite sensitive. And listen, women's health physio, they're worth their weight in gold. Okay, you don't have to wait until you're leaking or you're experiencing discomfort. Now, you don't have to wait before asking for a referral, especially if you're, concerned, or you might have had a previous, bad experience with scars. You can actually ask for a referral to a women's health physiotherapist who can guide you through recovering your core. That's really important. Strengthening your pelvic floor and even helping to manage your scar. How do you find it? I'm looking at tips for women after you've had your baby. We're talking about the initial phase after you've had your baby. What do you think?